The Ambulatory Intensive Caring Unit was the title of this white paper that was funded by the California Healthcare Foundation and released by the Mercer consultants. And it caught the eye of the administrators here at the Union Health Center because the white paper spoke to being able to deliver care in a very different way. And reading through the white paper, it actually matched a lot of the situations that we saw the Union Health Center to be in at that time. So prior to 2005, providers were always responsible for educating patients and taking care of the patients. And so making complex decisions with patients in addition to educating them was really, quite a task. And so it extended the visits beyond, their 20 minutes. And so a lot of things were left out and things were forgotten. So this white paper called the Ambulatory Intensive Caring Unit was just kind of something that we thought maybe we should just pilot and test out. It would help to take some of the work off of some of the providers' plates and give it to well-trained support staff, frontline staff, who would work with patients to educate them on self-management and goal setting.
Patient-centered medical home, I feel, is a perfect model, not only for providers, but for the patient. The providers can manage with the things that they need to deal with, and all these other education and follow-up could be perfectly done by a trained health coach. And that's what's so good about it. You could accomplish so much more as a team than what you can all alone. And what the result is, you get good outcomes. You get patients that know how to take care of themselves. And in the long run, that's what's gratifying, knowing that the patients can take care of themselves.
I think that the biggest benefit of this team model is that we speak, that we communicate, that we really are all singularly minded in trying to make sure that we provide the best health care we can for the patient.
I think the clinicians feel strongly about the model. I think they like the fact that they have support through a team-based model. It's difficult. It's difficult work being, a doctor, a nurse practitioner, a physician assistant, having a panel of patients that you're responsible for caring for. But I think having the extra support, but the support of folks who are really well trained, with a curriculum that is actually, things that providers want their patients to learn, I think is really kind of pretty remarkable.
Would I go back to the old way? Absolutely not. I cannot imagine just taking vital signs, putting a patient in, and just walking out, and just coming back to make an appointment. I would really, just to be able to sit down and talk to a patient, that is beyond what's so rewarding as a medical assistant.
The traditional model of healthcare is just something that providers can't do alone. And so today we're here as a patient-centered medical home using many of the best practices that we originated from this white paper.